There are 5 basic modalities of sensation that may be tested. For the purpose of a screening exam, we test one from the dorsal columns as well as one from the spinothalamic tract. The dorsal columns carry vibration, joint position, and light touch, and the spinothalamic tract carries temperature and pinprick. You may test either vibration or proprioception, and test either pinprick or temperature, so that you test sensation from the dorsal columns as well as the spinothalamic tract. When testing vibration sense, use a 128 Hz tuning fork. Start distally in upper and lower extremities and compare right to left. Ask patient to close their eyes, place the tuning fork on the bony prominence of the location that you are testing, and ask if they can feel vibration and tell you when it stops as the tuning fork stops shaking. Start on the big toe. If not felt there, you can move to the metatarsophalangeal joint, then to the lateral malleolus, then tibial tuberosity, and then anterior superior iliac spine. In the arms, start on fingertips. If not felt there, then you can move to the metacarpophalangeal joint, then the wrist, then the elbow, then the shoulder. To test proprioception, with the patient's eyes open, show them what you're going to do. Hold their distal phalanx between your 2 fingers, ensuring that they are at 90 degrees to the direction of movement. Move the digit illustrating which is up and down. Then ask patient to close eyes and repeat. Test distal joints first, the interphalangeal joints of the finger and toe. If proprioception is abnormal, then move to proximal joint. Compare left to right. Normally, proprioception can be felt by moving the finger 1 degree or the big toe 5 degrees. Start with small movements and increase, if the patient can't feel the direction of movement. When testing light touch, use fingertips to touch patient on arms and legs. Ask patient to tell you when they perceive being touched while they have eyes closed. Start distally and compare right to left. Ask if the sensation feels the same on each side. To test pinprick, use a disposable neurological pin or safety pin. Tell the patient that you want them to tell you if the pen is sharp or dull with their eyes open. Demonstrate both in an asymptomatic location. Have patient close eyes and then apply random sharp and blunt stimuli and note patient's response. As a screening test, you will start distally and move proximally on the upper and lower extremities. Compare right to left, asking if the sensation feels the same on each side. When testing temperature for a screening test, it is adequate to ask the patient if the tuning fork feels cold when applied to hands or feet. If cold is not perceived, then move tuning fork proximally along the limb being tested until it is perceived. You may use cold water to chill tuning fork if it has become warmed in your pocket. Compare right to left. Common mistakes made during the sensory exam is starting testing proximally rather than distally, or inadequate explanation and/or hurried testing during vibration sense and joint position sense. Drawing blood, varied pressure, and calloused skin during pinprick testing. Calloused skin and varied pressure during light touch exam. Normal variations may be interpreted as abnormality in pinprick exam as well.